Hello, Dr. Ramsey Amin here, speaking about 3 ways to avoid a sinus bone graft procedure for replacement of your upper back teeth with dental implants. Sinus bone graft procedure is something I perform very routinely in my office. It's a very successful, predictable procedure that is needed many times because the bone has been dissolved in the sinus. There's not enough height or length in order to place an implant in the area to restore the area with dental implants. The first way to avoid needing a sinus bone graft is to have the implant placed soon after the tooth is extracted. If you've only been missing a tooth for 3 to 6 months, that is ideal. That is, there's less of a chance that your bone has dissolved and atrophied, which naturally occurs in that first 3 to 6 months. So there's a pretty good chance that you can avoid the sinus bone graft procedure just by placing an implant in a timely manner. Implants preserve your bone, they prevent bone loss. The second option for preventing or avoiding a sinus bone graft is perhaps to have an upper back tooth replaced in an immediate fashion. That would mean the same day the tooth is extracted, to have the implant placed at the same time. You still may need a bone graft around the voids where the implant fits into the socket, because implants are typically smaller than teeth sockets are. So there may be some voids in the area that need to be filled in, but the sinus can oftentimes be untouched by placing an implant in an immediate same-day procedure at the time the tooth is extracted. The third and final way to avoid the sinus bone graft would be to have a bone graft of the socket done at the time the tooth is extracted. A socket bone graft is different than a sinus bone graft because you are not actually adding bone to the sinus itself. You're just preserving the bone height, the bone width, preventing the natural collapse that occurs when a tooth is extracted, where the sinus will expand into the area and you don't have enough height or length to place an implant in the area. So again, those 3 ways would be to place the implant in a timely manner, place the implant on the same day, or graft the socket at the time the tooth is extracted. There are many different types of bone grafting materials. You can search my blog on bone grafting materials. Be sure that you know very well about the type of bone graft that you'd like to have and that is successful in these particular areas. A sinus bone graft should not be avoided if that's something that you need or is necessary to have firm anchorage of the implant in the area for long-term success. It's a great and easy procedure to do. There are different types of sinus bone grafts. One is called an internal or closed sinus procedure, and one is an open or lateral window sinus procedure, both of which I do very routinely in my practice and are very successful. And if you need that, that is something that I would not avoid in order to have a successful implant. But avoiding the sinus bone graft will help reduce costs significantly and speed up the procedure tremendously. Thanks again. This is Dr. Ramsey Amin. Please leave any comments below if you'd like to have any questions answered, or feel free to come on in and have a look, and we'll go from there. Thanks so much. Take care. Bye-bye.